My name is Jerry Swenis. I'm from here in Brookings, have lived here most of my life, and I have served many businesses as their executive officer, as a chief executive officer, finance officer, positions like that. Well, first of all, I talked with my family doctor, Dr. Warren, here in town, and Brookings has excellent physicians. They just really do. And we talked about that, and he, it didn't make me feel bad, but he said, you really need to do that. So when I said, let's do it, he said, all you need to do is call my assistant. They'll set everything up. So they called the hospital. I had a brief physical just to make sure I was healthy enough to do the procedure. Absolutely nothing to that. Good to do that once in a while anyway. Then the hospital contacted me, very professional, gave me a list of what I needed to do, and set up the time with the surgical center here. And it took about a month just to get, basically it took more time to get in to see my doctor than it did to get into the hospital. It just had to go through that process. It was very well organized though. My questions were answered along the way. Is that nagging feeling that, something could be going on inside of me for the last 10 years, and I wasn't quite willing to do anything about it. And I know I'm not the first person that will say this, but sometimes you don't want to go in to get something if you think you might get bad news, and that can keep you away. And I'm that kind of person a little bit, maybe more than I want to admit. That's foolishness. That's foolishness. The procedures are here, and the process is not just simple enough, but they can correct things that show up, especially with that type of test. It's complete foolishness to take that chance. I always knew that was a little uncomfortable, but really for me, if you can just tell yourself that, can I drink more water than I normally would for a couple days? That's really what it comes down to. The preparation, as simple as it was, that was the worst part of it. It was. The rest of it is a piece of cake. When you see people to come and look at you and they're really connecting with you, and they know what they're doing, I think that was part of it for me, and I do really tune in on that. I wouldn't be here if I didn't believe what I said, and I've been some places I wouldn't do something like this. Not that people don't try, but it's not the same always. And when you're in a setting where people are good at what they're doing and they care, and I don't say that lightly neither, because we can all have the mission statement that says all these nice things, but it's the people that show it. Probably hard to admit, but that's probably one of the things that was the biggest concern to me, and maybe one of the things that kept me from doing things earlier, because I'm a very private person, and maybe guys aren't like that, I don't know. I just know. Maybe like my mother, I'm that way. And I knew I shouldn't feel that way, but sometimes you just do, and I did. And so I came in that morning resolved. I was very comfortable. I knew I was in good hands. I did. But I still, once I started to see how the privacy was handled with 100% respect for my thoughts and feelings, I didn't have to say anything. I didn't have to ask anything. It was just done in a way that people knew that you would be concerned about these things. It's a procedure that really needed to be done, and I felt so good to have had it done that honestly that's probably what I appreciated the most. To know that it was going to be done correctly and done by people that are very competent, pretty much the same thing. And again, the fact that all I had to really do was just show up. That was it. Drink some water ahead of time. I'd summarize it. You drink a lot of water and you show up and you go home. And it's just not a big deal at all. I was very pleasantly surprised with how efficiently laid out the new facility is. Everything is right there, the people are right there. You're taken into an area and you don't have to worry where you're going at all. Everyone comes to you, and then you have a short trip to the procedure room. Everything was very simple. My wife was taken care of well while I was there, and the doctor came out and talked with her when it was done. And for me, maybe the best part was I hardly knew what was going on after a certain point in time. It was just done, So for all the hesitant guys out there, there's no excuse whatsoever. I would look them in the eye and say that if not for your own benefit, at least for the benefit of those who love you, this is something you need to do. Because the options are great now. They might not be if you don't do this. Most insurance companies will pay for it. It's not really an issue financially. The process is very simple, much better than it was maybe 20 years ago. there is just no reason whatsoever not to follow the medical recommendations. At 50 years old, I think, I'm not a physician, I think that's what it is at that age, to start it and stay with it. There's no reason not to. We believe that the healthcare in Brookings is very, very competent. They don't try and do everything, but what they do well. So my position is this: we start here and we do everything we can here, and we've had nothing but good results. You can be taken care of well here in Brookings or transferred. I'm not against Sioux Falls, but we need to support our local healthcare system. And I have confidence in the local providers that if they feel something is warranted elsewhere, they're not going to hesitate to do that. So I would offer to people that come to Brookings healthcare system first, and that's the most honest recommendation I can give you. And that's what I would tell people: come here first, and if you need to go elsewhere, they'll not only suggest that, they'll help you set it up, and the whole process will go much better that way.